muted. While I'm lecturing, if you have a question, you are free to unmute your mic and ask the question. Uh, don't, it's not rude or anything to interrupt me. I like the interaction. If you want to wait to the end of the presentation for me to answer questions, I will. And if you also have, if you're posting questions in the chat, Marion would also be viewing those questions, and then I will answer all those questions once we finish. So I am thankful for being here today. I'm thankful for all of you logging in. Without further ado, we'll go ahead and we'll get started. So health effects of smoking. Smoking is the #1 cause of preventable disease and death worldwide. Smoking-related diseases claim more than 480,000 lives in the U.S. When we talk about preventable diseases, what we mean about that is smoking is a choice. So you have a choice to smoke and you have a choice not to smoke. So a lot of, smokers who do smoke, uh, if they have underlying illness or underlying diseases, smoking can cause those diseases to actually exacerbate, which means it makes them a lot worse. So when we say preventable, that's what the whole concept of non-smoking is we like to encourage people who smoke to stop smoking because it is in itself preventable. Cigarette smoking contains more than 70,000 chemicals, at least 69 of which are known to cause cancer. Smoking is directly responsible for approximately 90% of lung cancer deaths and approximately 80% of death caused by chronic obstructive pulmonary disease, COPD, including emphysema and chronic bronchitis. So the fact to note about smoking itself is the chemicals that are utilized in the smoke. These chemicals itself can cause cancer, uh, can cause a disease, which is called COPD, and emphysema, chronic bronchitis. As most of you probably know, there's not a cure for cancer. Cancer is treatable in certain areas, but for a lot of people, cancer is incurable. So if someone had cancer and cancer was due to smoking, and you were to ask them, 30 years ago, 40 years ago, when you started smoking, if you could go back in time, would you have stopped smoking in order to prevent your body from growing cancer? Probably 100% of those patients would tell you yes, because cancer is such a debilitating disease, not only for the patient, but also for the family members. Chronic obstructive pulmonary disease is also a debilitating disease because chronic obstructive pulmonary disease is a chronic disease. Chronic means long term. So most patients that have COPD, again, it can be exacerbated if they were to develop pneumonia, COVID, okay, any of the other diseases in combination with COPD or with cancer. Sometimes it's too much for your body in itself to handle. So a lot of times patients medically don't do well. And the important thing to note is that smoking is the root cause of a lot of these illnesses. If they were to stop smoking or if they never started smoking, then a lot of these ailments the patient would not have. Smoking is the leading cause of preventable death in the US, causing over 480,000 deaths per year. Secondhand smoke is a serious health hazard for people of all ages, causing more than 41,000 deaths each year. Of course, we know what secondhand smoke is. Maybe your parents or maybe your grandparents or even maybe you smoke in the house because you don't want to go outside. And most people, it's my house. I can smoke in my own house. I pay the bills here. And you have your kids there, other family members. Secondhand smoke can also cause cancer and COPD and different things of that nature. So just because you're not directly blowing into a cigarette, it does not mean that you will not have some of the long-term effects of cigarette smoke. Also, marijuana. Marijuana smoke contains many of the same toxins, irritants, and carcinogens as tobacco smoke. So, a lot of people perceive marijuana smoke as being safe. It's marketed. It's not marketed as cigarettes, as a hazard for cigarettes. So a lot of people, smoke marijuana for medicinal purpose. But again, marijuana also contains toxins and irritants. E-cigarettes, which we're going to cover also, because e-cigarettes is the next pandemic for our young adults. E-cigarettes are a new tobacco product, and the potential health consequences and safety of these products are unknown. So e-cigarettes has probably been around for, I want to say, maybe the last 10 years. The reason why the potential consequences of e-cigarettes is unknown is because not enough time has passed. A lot of people have been smoking cigarettes from the beginning of time. So researchers have studied cigarette smoke and studied your cardiovascular and your respiratory system. So we know what effects smoking can contribute to, but we have knowledge of what e-cigarettes can contribute to, but what the end result of it is, we don't know yet, because it hasn't been enough time yet to pass. So within the next 10, 15, 20 years, there will be more research and more data that can tell you the potential health effects of e-cigarettes. Smokeless tobacco produces products or additives known to cause cancer and are not safe alternative to cigarettes. So a lot of people use smokeless tobacco. They put it in their jaw and they spit. A lot of times that can cause throat cancer, tongue cancer, a lot of things of those natures. Esophageal cancer. Well, you have to have an esophagectomy where they have to remove your esophagus. If you ever seen a person that has to talk with a voice box, a voice box means that they remove part of their airway. So because of cancer, so now they have to speak with that. It's a very tough life to live when smoking is preventable. And what that means is, if you were to not smoke. Now, to say that everyone who smokes a cigarette, or everyone who is around secondhand smoke, to say that all of those smokers will develop cancer or develop COPD. In some cases, it's not the case. It's a very small percentage of people who may be able to smoke for their entire life and may not have, a debilitating ailment. And then there's other people who may smoke, two packs a day for maybe 2 years, and may end up with lung cancer, may end up with COPD. So the main point is that you have the ability to stop smoking. You have the chance to not smoke at all. So that's what the main goal or the main push is. Cigars have many of the same health risks as cigarettes, including causing certain cancers. So, people smoke cigars as sometimes an alternative to cigarettes. Hookah smoke contains many of the same toxic components found in cigarette smoke. So a lot of the young population, like to go to these hookah bars and get the different flavored hookahs, and you smoke the hookahs, and you're like, oh, well, hookahs is fine to smoke, because you in turn say, well, they're not as bad as cigarettes. But in turn, hookah smoke contains some of the toxic components that cigarette smoke has. Any type of smoke that you inhale and that it diffuses through the lungs over time may cause some type of illness. No matter what type of smoke it is, it's not good for you. Nicotine, is the additive in tobacco products. Cigarettes, cigars, smokes, tobacco, and nearly all e-cigarettes contain nicotine. Nicotine is the addictive drug that's in tobacco products, and that's what makes it so hard for people who smoke cigarettes to quit, because they're addicted to the nicotine. Once you start, once you become addicted to nicotine, then nicotine is in the same chemical family as caffeine. Okay, so those are uh, addictive forms of different types of drugs. So a lot of people who, if when they do try to quit smoking, you have to give them a nicotine patch in order to wean them off. Because sometimes if you try to wean yourself off nicotine too fast, you may have withdrawals. The American Lung Association, which a lot of information that I am presenting to you today was um, utilized from the American Lung Association. The American Lung Association has a very a wealth of information about how to quit smoking, uh, different focus groups and resources that if you want to quit smoking, that all you have to do, in this day and age of the internet, if you were to go to www.americanlungassociation.com, and you will see all the resources that they have that you can utilize to, to quit smoking. You can also talk with your physician. If you're, and then I'm sure if your physician know that you're a smoker, that they encourage you to stop smoking. Mainly if you want to go see the doctor for a physical, they also can provide you resources to help you in your fight with smoking. Menthol is the flavoring added to tobacco companies have relied on to make cigarettes more appealing and addicting. So menthol, like a lot of people smoke those menthol cigarettes because of the flavor, okay, because of the smoke itself. So again, to say that there's with cigarettes, cigarettes is a big business. So a lot of tobacco companies, of course, they're not going to tell you um, the bad effects of smoking because it's their product and they're trying to sell it. What their job is to put menthol and nicotine in these products to make them more appealing to you. So in some forms of fashion that you can become addictive, and then you can buy more of the product. Key facts about smoking. Young adults who have never smoked daily, 78% have smoked their first cigarette by the time they were 18 years of age. 94% had by the age of 21. So there's 94% of young adults that have smoked a cigarette by the age of 21. Among adults who have ever smoked daily, 78% have smoked their first cigarette by the time they were 18 years old of age, and 94% by the age of 21. So again, adults themselves, by the time they were 18 years old, had smoked their first cigarette. Among current smokers, 73% of their diagnosed smoking-related conditions are chronic lung disease. So 73% um, of current smokers, okay, 73% is a lot, are diagnosed with smoking-related conditions of chronic lung disease. Even among smokers who have quit, chronic lung disease still accounts for about 50% of smoking-related conditions. So to say that is to say if you haven't started smoking, don't start. If you have a family member or you have a close friend and they're smoking, your job is try to encourage them to stop smoking. I mean, try to encourage them to stop smoking, because if understand this, having chronic lung disease when you're in the twilight of your years, when you're in your late 50s, 60s, 70s, when you want to enjoy your grandkids, when you want to enjoy life and travel, and you cannot travel because you're always short of breath, you're on oxygen, so it's the best course of action is to never start. The best course of action, if you are smoking and know someone to stop that is smoking, try to encourage them to stop smoking. Smoking increases your risk of age-related macular degeneration, which means your eyesight gets bad. Of course, as we age, our eyesight gets worse. Macular degeneration can lead to cataracts, which can lead to blindness. Is the leading cause of blindness in adults over the age of 65. So again, I mean, you know, at the age of 65, you want to enjoy life. You done worked, you know, the majority of your life. So you want to really enjoy your life. If you know, smoked for half of those years or more than half of those years, then the effects that the smoking will have on your body is not positive. It's basically debilitating, especially for someone that's 65 years old. Smoking also contributes to type 2 diabetes and increases the risk of complications from the disease, including blood flow to the legs and feet. This can lead to infection, result in the need to amputate a limb. Yep, you could lose your foot or your leg. If you ever seen someone that has an amputated foot or an amputated leg, that has a prosthetic limb or has to get around in a wheelchair because of type 2 diabetes that will complicate it from smoking. Again, if you were to ask them, hey, all those years ago, if you could go back and tell yourself to stop smoking, would you have done it? And most of them would tell you, yes, I would have, because I can't get around. I have to have help everywhere I go. I'm not really enjoying my life. When we're young, we're strong. So you have that where you're invincible. So, you know, smoking socially is cool. You know, smoke a couple of cigarettes, you're fine. You know, smoke a couple of cigarettes, you're fine. You know, the effect doesn't happen, you know, until you start to get older. When you know, when you want to retire, you know, and things of that nature. So, again, being smoke free is probably the best course of action. Male sexual function is affected when you smoke. Tobacco causes narrowing of blood vessels all over your body. So for males, erectile dysfunction can be an issue from smoking. Ectopic pregnancy is a life-threatening reproductive complication of women that is more likely as smokers. So again, of course, if you're a female, you shouldn't smoke because you can, your child can be born with birth defects. So again, that's uh, you know, is a big negative. Smokers lose bone density at a faster rate than non-smokers, which puts you at risk of breaking bone parts like your hip. So of course, as we get older, our bones get weaker and weaker. So, you know, at some point in time, you may have to have a hip replacement, knee replacement, a shoulder replacement. Uh, smoking can complicate Smoking can complicate these. So you may be in your 40s and you done smoked cigarettes for 20 years and may need a hip replacement or may need a knee replacement because you have lost bone density, which was complicated by smoking. Common lung diseases. Again, we talked about, I'm real familiar with, as being a respiratory therapist, I'm real familiar with COPD patients because COPD patients is probably 85% of the patients that we treat in the hospital. Most COPD patients that come in the hospital, most of them are smokers or were previous smokers, and they're not necessarily coming in for COPD because sometimes they can have their COPD under control. They're coming in because they develop pneumonia. They developed the flu. At this time and age, COVID. For a lot of patients who had a pre-existing illness prior to COVID and contracted COVID, that is your population of patients who may not do well, okay, who may not do well. And it's just an unfortunate thing that, again, we talk about smoking as being preventable. So, you know, we try to keep that, try to keep that in mind when you're discussing these issues with people who smoke. You know, we tell you the bad because we want you to quit because there's really no good to it, you know. So there's no positive to being a smoker. There's, you know, way more negative for people who have issues with smoking. Over time, exposure to irritants that damage your lungs and airways can cause chronic obstructive pulmonary disease, which again is termed COPD, which includes chronic bronchitis, emphysema. The main cause of COPD is smoking, but non-smokers can also get COPD too. So non-smokers can get COPD from secondhand smoke. Non-smokers can get COPD from cigars. Non-smokers can be genetically predisposed to develop COPD also. So to say that is to say, again, just because you smoke, you may not develop COPD, and just because you don't smoke, there's still a real small percentage of the population that can develop complications from COPD. And what we mean by that is asthma, chronic bronchitis, and asthma and chronic bronchitis are the two areas of COPD that you don't have to be a smoker to develop. You can have complications due to smoking, chronic bronchitis and asthma. Common lung diseases, about 85 to 95% of all COPD cases are caused by cigarette smoking. When a cigarette burns, it creates more than 7,000 chemicals, which is a lot, many of which are harmful. The toxins in the cigarette smoke weaken your lungs' defense against infections. So if your lungs are weak against infections, that means any, the flu, pneumonia, um, again, COVID, anything that can affect the lungs or attack the lungs, it's almost twofold now because your lungs are weakened due to smoking. Narrowing of airway passages, cause of swelling of air tubes and destroy sacs, all contributing to factors of COPD. Narrowing of air passages, swelling in air tubes. Your air tubes is basically your airway. These are some of the common findings with patients with COPD. This is what makes you so short of breath. And also your lungs are diseased. So your oxygen doesn't diffuse through your body like it's supposed to. So here's a picture of a smoker's lung. This is a good lung. Your lung should be nice and pink. You see how a smoker lung is from the smoke has caused it to become dark. That's why a lot of patients who are smokers' lung on oxygen, when it's pink like this, that is vibrant. That means there's good blood flow. When it's dark like this, there's less blood flow. You're prone to all different types of other ailments, pneumonia and the flu. This just looks bad. I mean, it looks really, really bad, but this is how a smoker's lung would look. This is another picture of a tissue taken from a smoker's lung. Note, we all know that your lungs should be pink, but you see this dark tissue of tar is basically what it is. How it has caused your lungs to degrade and become, not work as they supposed to. They become weak. They can't fend off different types of diseases. And again, as you get older, your lungs get worse and worse. They don't change, okay? They don't change. They get worse and worse. So our next topic that we're going to go into is vaping and e-cigarettes. And again, vaping and e-cigarettes, we discussed earlier that there's data on it, research on it, but it's not as much as it is for smoking because again, smoking has been around, for since the beginning of time. And most of us see the infomercials about smoking, about quitting smoking, and they'll show you the different patients on TV with oxygen on. They had one commercial where a patient was doing tobacco, so they had to have reconstructive surgery on their face. So once he took all his teeth out, you can see how his face folded, which again was the effects from smoking, which again a lot of us know or have seen. There's not a lot of infomercials about e-cigarettes yet. A lot of things that you hear bad about e-cigarettes, you hear and vaping, you hear in the news. But again, if you are vaping or if you are using e-cigarettes, those are not cool to use. If you know someone who's using e-cigarettes or using vaping, you want to encourage them to quit. Again, vaping and e-cigarettes are just as bad for you as smoking. The Surgeon General reports e-cigarettes use among young is a significant public health concern, and steps must be taken by parents, educators, which is us, and especially policymakers to discourage the use of e-cigarettes. So again, a lot of times the way to discourage use of e-cigarettes is the price. That's what they did in the past with cigarettes. They increased the price so that, um, so that would try to deter people from buying. E-cigarettes and vaping, they're starting to go down those track with with them too, because that is becoming a pandemic again among the youth. Okay, when your body is just starting to develop and just starting to grow. Learn more about e-cigarettes, lung health risks, and get downloaded resources for parents, school, and teens. Again, all of this information, a lot of it, the information can be viewed on the www.American Lung Association. They have a lot of good resources. Electronic cigarettes or e-cigarettes are tobacco products that have been sold in the U.S. for about a decade. So again, about 10 years. So it usually takes us about, 15, 20, 30, anywhere from 15 to 20 years to get facts and extra data, proven data of what happens when someone has a e-cigarette. So if it was 10 years ago and you started smoking 10 years ago, so probably in another 5 to 10 years, your body may start to change due to the effects of e-cigarettes. So, that's when the researchers are able to do those different, studies. Used as for about a decade, they include e-pens, e-pipes, e-hookah, e-cigars, known collectively as ends, electronic nicotine delivery system. They're also sometimes called jewels, vapes, vape pens. E-cigarettes are the most commonly used tobacco product among kids. So these are our youth. And it has become an epidemic. I think a lot of kids think that vaping is cool. Vaping is not cool. Vaping is probably worse than cigarettes because, again, we don't know the long lasting effects of it. There is some literature, which I'm going to show you at the end of the presentation, of some young adults who have vaped and how it had debilitated their lungs in a very, very short period of time, which is very, very scary. While much remains to be determined about the lasting health consequences of e-cigarettes, there's evolving evidence about the health risks of e-cigarettes on the lungs, including irreversible lung damage and lung disease. Can you imagine having an irreversible lung disease at 20 years old, 21 years old, 22 years old? I mean, your life expectancy is already cut in half. You can't enjoy the things that you wanted to do with your friends because you're short of breath, or you're more susceptible to different types of diseases. Vaping and e-cigarettes, January 2018, the National Academies of Science, Engineering, and Medicine released a consensus study report. They reviewed over 800 different studies. The report made clear using e-cigarettes cause health risks, which should be common. It concluded that e-cigarettes both contain and emit a number of potentially toxic substances. The academics report that also states that in moderate evidence that youth who use e-cigarettes are at increased risk for cough and wheezing and an increased risk of asthma exacerbation. Asthma is one of the most debilitating diseases, especially for young adults, because you can have an asthma attack at any time without any warning. So if your asthma exacerbation is uh, is to the point to where you have to be admitted to the hospital, that's not again, that's not something that um, you want to be involved in. A lot of patients who have asthma exacerbations, a lot of them end up on a mechanical ventilator. A mechanical ventilator or intubation is when we take a tube, we put a tube down your throat, and we put you on a machine to breathe for you. Most people call it a breathing machine, but the name of it is actually called a ventilator. So when you have asthma exacerbations, sometimes that have to be done with you because your airway is collapsed or closed off. So if your airway is closed off, then we have to put a tube to breathe for you. If not, then um, your life expectancy will be very, very short. E-cigarettes also contain alkaline, a herbicide, primary use to kill weeds. Okay. It can cause acute lung injury and COPD. Again, COPD can be caused by e-cigarettes and by just regular cigarettes and by vaping, and may cause asthma and lung cancer. Again, asthma and lung cancer are both debilitating diseases. Asthma can be treated. Lung cancer can also be treated. Certain types of lung cancer can be treated. Asthma, the doctor will prescribe you bronchodilators or butyral atropine or inhalers, which try to curb your asthma attacks. But sometimes there's different triggers for asthma that you yourself, your physician, is not aware of, that can send you to have an asthma attack. So now you have frequent emergency room admissions. These things cost. Being admitted to the emergency room and having all these different ailments, they cost money. You don't get to go to, unless you are a veteran and so forth. Healthcare is not free. So when you have COPD, when you have asthma, when you have lung cancer, again, besides the debilitating effects that it has on you, it also has an effect on your family. So you have to think about your family. Here again, this is a 17-year-old. 17-year-old hid his vaping for over a year until he was rushed to the ER and collapsed lung. This young man, mom, is a nurse. Okay, so he vaped for a year. 17 years old, vaped for a year. So this is just a standard chest X-ray. This is your heart. This is the left side. This is the right side of his lung. This is where it collapsed at. If your lung collapsed, it hurts. It really, really hurts. And it makes it very, very difficult to breathe. So you have to be admitted to the hospital. He didn't realize his mom didn't really, of course, at 17, he didn't know what was going on with him. He was just short of breath. But once he was admitted to the hospital and they started taking his history and physical, and they found out that he was vaping and that vaping was the cause, his mother did she's the one who did the info commercial about vaping and discussed what it did to her son. Again, 17 years old, 18 years, 17, to probably 21 is the age range for young adults who vape. So there's been a lot of news about young adults who has vaped and the debilitating illness that it has caused them moving forward. This young man, so he's a teen. So this type of device that he's on, this is what we call a high flow nasal cannula. So when you are severely deprived of oxygen due to lung disease, this is what we put you on. This is a young man. So he is suing a vaping company, Juul, after being left with lungs like a 70-year-old. So all of this in your lung, in your x-ray, your lungs should be black because that's air. When it's white, that means that is some type of disease causing in your chest x-ray. So to be this young, to have lungs like a 70-year-old, so throughout his life, he's going to have to frequent hospital admissions. He's going to always be short of breath just because he vaped. And then this is the last. So this is intubation. Okay. This is what it looks like when you're on a mechanical ventilator. Again, another young man, 22-year-old, has warning for others following his vaping-related lung injury. Vaping caused his lungs to basically shut down to where they have to intubate him and put a tube inside of his airway. So, you know, and he was on a mechanical ventilator for a while. He's just 22 years old, and now he has lasting effects from vaping. I'm going to share his story with you all. I thought it was very, very interesting. I'm just opening up the video to view. Okay. Let's turn this around. Okay, so stop share. Share.
The most innovative breast cancer screening technology available, including 3D tomosynthesis. The Breast Center of Maple Grove and Imaging Center of Plymouth are conveniently located and offer a relaxing and comfortable environment. Call to schedule your mammogram today.
Well, you may remember this horrifying picture behind me. It's become one of the images of the vaping epidemic seen across the country. Now, Elijah McClure of Brooklyn Park is out of the hospital, and tonight he has a warning for others.
The doctor point blank said that at this point, there's nothing we can do.
For 12 days in late August and September, a ventilator did the work Elijah McClure's lungs could not.
That was probably the hardest thing because, you know, I'm grabbing your hand and you're not responding.
It wasn't until he left the hospital that the 22-year-old realized his battle with a lung injury caused by vaping had become national news.
I haven't heard my son's voice in well over a week.
It hurts me more to put you guys like do this whole thing that it gets to me.
Remarkably, the physical impact no longer gets to him. Less than 2 months later, he has no signs of scarring.
Have you noticed any impact on your lungs?
Actually, I haven't. My lungs feel back to normal, which is amazing.
What did your doctor tell you about how serious it was?
It was a couple of days while I was in there that they didn't know if I would make it or not.
At the time, Elijah was one of about 450 cases nationally. Now, there are nearly 1,900 cases and 37 deaths.
Predominantly in these cases, it's been off-market or illegal THC cartridges or carts that are being sold. Does that apply to you?
I was using two forms of vaping, yes, carts and e-cig.
Elijah says he started by vaping nicotine at the age of 15, but says parents should know in recent years, illegal THC carts have exploded in popularity.
Don't be oblivious to the fact that your kids may try something out there. Carts, vapes, regardless, it's on the uprise. They're not very hard to find if you're looking for one.
Elijah is sharing his perspective and the vaping products he used with the FDA. And as its search for a cause continues, Elijah says his cause is helping others.
If I could help people, then I can get to that state, and of course I will speak every day, every minute that I can.
You dodged a bullet.
Yeah, literally.
Well, it was obviously very hard for him to talk about this, especially in front of our cameras. We appreciate him doing it, though.
Yeah, he certainly, did.
Okay, well, that is the end of my presentation for today. I'd like to thank you all for attending. If there's any questions now, you may unmute your mics and ask questions. Okay, well, I guess there are, since there are no questions, if there's no questions, thank you all for your time. Thank you all for listening. I hope you all learned something, and I hope that Again, you yourself can be an advocate for either your family or if your friends, if they're smoking or vaping, you try to encourage them to quit. With that, I'd like to tell you all, have a blessed semester and stay safe. Thank you, Marion.
Dr. Jackson,
All
thank
right.
you.
So
Very
well.
informative. That was one of the comments. I know that our the audience got a lot from this presentation today, and then the
Great.
emotional impact at the end was great. So
Great. Thank you so much.
you guys have a great day. Thank you so much for attending. Refer to the comments in the chat regarding the gift card available, and also the fact that this presentation will be available on YouTube.
Excellent. Excellent. Excellent.
And don't forget to sign up for your smoke-free T-shirt to get to sign the pledge and to get a free T-shirt. I put that in the chat too, the link, so that y'all can get to it. Do I need to repost it?
Oh yeah, that would be good, I guess.
I think it got lost.
There we go. Awesome. So everyone click that link to get your T-shirt, and everyone have a lovely rest of their days. And take this to heart.
Thank you, everybody. We appreciate it. Hope we'll see you at the next one. And remember, check out Presence, our leadership, our Eagle experience, and look at what's coming up next for our events. We have a lot coming up. Good night, everyone. Or good afternoon, I guess.